Hey, everybody. Good morning, good afternoon, and good evening, wherever you are in the world. So welcome to our show with Dr. Lisa Fox, a third-generation veterinarian. Hi, Dr. Fox.
Hi, how are you guys?
We are awesome. And we're going to be talking about a bunch of very interesting things. And we're going to start with the increase in job dissatisfaction, fulfillment, and also suicide in our veterinarians. And while it might sound like a downer, everybody, you're in for a treat because it's very interesting on why this is happening. And I think, if you want to share this with vets in your world, it'd be really nice to share with them. So we're going to get going right into that. But really fast, I want to introduce you. You're an amazing holistic vet. You have a mobile practice. You go to people's homes. You do house calls the old way, which is amazing. Where dogs and cats are their most comfortable, and horses.
Yep.
And you are definitely holistic oriented. So let's see. You have I love the name of your business. It's Divergent DVM, which means you diverged from the standard path, right?
Yeah, I was a conventional vet for 9 years. I grew up in the conventional vet practice. My grandfather was a vet. My father was a vet. And in 2018, I had the chance to kind of diverge away from that. And I became a standardbred racehorse track vet at night. And during the day, I started my holistic practice. So.
Amazing. Gosh, and working with the horses is just beautiful. They're beautiful animals. So the other thing is, like I said in the quick beginning of the intro, your father and grandfather were vets, and you just said that. So, did you ever? I mean, you obviously saw a career path for yourself. Did you ever, or did they ever doubt that this would be a good choice for you going the holistic route?
No, my dad, he got to see me do a lot of my holistic stuff before he passed away in 2020. And he really was gung-ho for it. He liked what I was doing. I actually, I do iridology in humans. I have a master in iridology, and I actually used that to diagnose his esophageal cancer about 6 months before the medics did. And so he got kind of the full brunt of my holistic side of things. And
Wow.
He was on herbs and everything else, before he had surgery and unfortunately did pass. But so he was very into what I was doing. And he actually left the job at the racetrack. He had retired about a year earlier. He left the job at the racetrack because of complications with his illness and everything. And he was like, okay, this is your chance to get out of the conventional world at my family's vet hospital that we started in 1951. And he's like, go do what you want to do. And so he really pushed me down that path. So.
Wow. Good for you and good for him. So on this whole dissatisfaction in the career, the veterinarians are facing this at a high level. Did he see that coming like way far ahead? Like how, the veterinarians are more constrained. We're going to get into this, but.
Yeah, he's actually, he had a couple of veterinary friends that were around his age that ended up dying by suicide as well. So he was touched by it. We had a few that died by suicide because of the things that they encountered in the career path. And then one that passed by suicide because of other ailments that we didn't think had a connection to the vet world, but I'm starting to see a little bit more of older vets with Parkinson's. And I'm wondering if it's some of the dewormers that a lot of the older vets used that they come and become contaminated with. And if that's kind of showing up as more of a Parkinsonian kind of a thing as our generation gets older. So.
Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel. It sure does help us get discovered by more people like you who need information like this. And also, down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show.
Interesting. And obviously, you know, death by suicide is very complicated. It's you know, it is usually multiple layers of things, but you know, every time I've talked about this topic, it seems like if you have a career that you're contributing, you're passionate about, you're contributing to and feeling great about at a really high level, even with other things going on in your life, that could be a thing that keeps you going. But if that's also a mess and you feel like you're just this small cog in a huge system that's, you know, chewing you up and spitting you out, is that what you think is the cause of the majority of death by suicide?
I think there's a lot of different causes, and I just did a webinar on it recently for the College of Integrative Veterinary Technologies, and
yeah,
what we're seeing is the first part of it is we all go into vet school. We're all very type A personalities. We're used to being at the top of the bell curve, you know, and then we're getting kind of shoved into these classes where someone has to end up at the bottom of the bell curve, and we're not used to it as students. We're all used to straight A's and being very almost we are very I don't want to say OCD, but we're kind of OCD in that, and we're very hard on ourselves, and we're perfectionists. And so when we get that perfectionist trait, and you cannot be perfect in vet school, then we get that kind of first onslaught of death by suicide, which we do have a contagion issue as well, where if you are exposed, the more you are exposed to it, the higher percentage you are of actually dying by suicide. And that's been proven statistically. And then the other thing that we've noticed is because of the debt getting out of vet school, I mean, your average is $250,000 in debt when you get out of vet school, and you're making what? Some small animal vets make $80,000 a year when they just get out. Most large animal vets are making, I want to say, $60,000 a year. I haven't looked at it recently, but I mean that's a complete huge issue when you're trying to work on paying off your debt, your life-work balance.
Yep.
And then there's a lot of vet situations, and I've been in quite a few of them because I've been back and forth, you know, trying to. Maybe I should stay in the conventional world a little bit. Maybe I should, you know, just do my holistic. And you get into these environments that are very hostile environments, and it becomes a bad issue. I mean, I know I've been on the suicidal ideation end of it before, and during vet school and after vet school, and it took me acknowledging that I have a good support base and that I have a family, and I need to take care of that to get me off of that. And then that's what kind of put me into wanting to talk about suicidal ideologies with veterinarians, because everyone needs to know that there's someone there and we're all going through it together.
Yeah. The vets I've talked to about this and in private have all said to me that there is all of those things that you're talking about, and they're trapped in a system that from the beginning takes these problem solvers and these high performance types of people and puts them in these small boxes and says, look, you know, it's paint by numbers. It's, you know, it's a simple algorithm on a sheet of paper. If this, then this. So there's no creative problem solving. There's no solving health problems, which is why everybody gets into this. You know, it's to be.
We're problem solvers.
Problem solvers. Yeah. And so, but there's, you know, the dog food that you have to feed if you want, you know, to make this amount of money. And it's a whole system that's carved out for you. If you go that system, not everybody does. I mean, you know, clearly you didn't. Well, you did for 9 years, but, you know, you've gone the other way. So do you feel like that's it? Because, you know, we hear about the big companies that, you know, they own the veterinary facilities. They own the food companies. They own the at least pieces of these, the insurance, the pet insurance companies. And I wouldn't be surprised if they own part of the funeral, services for, the whole thing. So do you feel like that's part of the reason?
I think it is as well. I worked at my family clinic for 9 years, and a couple of those years was before we actually got a practice manager. And so I was pretty much instrumental in saying we need a practice manager because we as vets are not practice managers. And that's a lot of it is vets are trying to be the practice owners, practice managers, and a veterinarian. And that's not our skill set. We need to delegate a little bit more on that. And that takes out a lot of the stress when we delegate that. I've worked at spay and neuter clinics. I've actually taught surgery to a vet tech school up by me. I have worked for the big companies for vaccine clinic. So I've worked through all of that, and it is very, very pigeonholed where they're like, this is what we do. This is how we do it. You have to do A before you do B. And when you get clients in or patients in that A and B don't fit, or they don't have the money for them, then you can't just jump over to C with some of those big practices. And for me as a holistic vet, I don't want to step on the conventional vet's toes because I know how stressful it can be. I've been told multiple times, oh, you're only in it for the money. You get a lot of stress and blowback from clients, and they don't have another option. They don't know where to go from there. And so with my holistic, I have a whole nother toolbox that I can utilize. And that in itself decreased so much stress for me. And it's really funny though, that I was so much more stressed out working in a conventional clinic, even my family's clinic, than I am now doing holistic a couple of days a week. And then I work for an in-home euthanasia service a few days a week. And you'd think that the in-home euthanasia service would be more stressful than the conventional. And it's really not. It's so much more people focused, and they're so appreciative of what you can do for them that it's not the same thing as being in a clinic.
Yeah. Wow. So people accuse you as a holistic vet of doing it only for the money?
Not as much as a holistic vet. I don't get that as much as a holistic vet. I get that. I got that a lot as a conventional vet. And it was usually, the cases that came in where the dog is on death's door and I need to do X, Y, and Z to be able to figure out what was wrong with it and then treat it. And they're like, well, we don't have that much money, which obviously, I completely understand that. So we try to work around it. But in the end, I'm trying to feed my family. I'm trying to feed my employees' family. And so I think there's that, like, medical doctors, human medical doctors don't have that as much as, we do. They don't see the billing part of it. They get billed through insurance. They get billed through different routes. But as vets, the insurance works completely differently. So even if, the practice is owned by the insurance, the client is giving that to them later. So they see the bill later and they need to pay for that first. And so I think that's a big reason why we as vets have more of a suicide rate, 4 times more than the general public and 2 times more than actual other medical fields.
Interesting. So the difference between like the commercial, conventional vet path, that compared to holistic, do you feel like, how much did you spend in 9 years with each patient? Just give me an average number during a session. How many minutes did you spend with them?
20 minutes.
And how much do you spend now?
Their first appointment, usually at least an hour, 45 minutes for horses. That depends on if it's their first appointment or not. And then, I go, an hour is probably my top end. But most of the time it's well over the 20-minute mark. And I know those clients, and that's not including me emailing them, looking up herbs and everything else.
Yeah. So So you've got 4 to 5 times more time with your clients, with all their questions, getting to know the animal better than you did in a conventional practice. Wow.
Right. Yeah.
That's amazing.
It's so much. It's liberating to be able to connect with your client on that level. Versus, when I was in the vaccine clinic and we literally had 5 minutes to give vaccines and shove the animal out the door. And to me, I did that to make a living in between things, honestly, but my heart was not in it because I couldn't just keep shoving things into animals. And I had to go with what the company wanted me to do. And so I actually quit that in the middle of my my contract because I couldn't do it anymore. So, but you do things to raise your kid.
Oh, I can't even imagine. I mean, I know this is an overused term, but you could not pay me enough to do that. I mean, day in, day out. Wow. So I want to go back to something you said about relating it to the death by suicide in the veterinary industry, and it sounds like the chemicals and the things they're using, and that you mentioned the dewormers. What is it you think? Are they breathing something in? Like what?
I remember my dad didn't do it as much. It was kind of a little bit before his time, but I remember them doing boluses to horses with a blow tube for a dewormer. And sometimes I don't think it's paraquat, but I know it was something similar. It could blow back into the lungs. And they didn't think about it then at all. I mean, obviously, we don't think about the different chemicals that are now coming up with, different lawsuits and everything that we've been using for years. And so for me, just going to some of these Midwest, like some of these conferences, and you see the older vets that, you've known growing up in the industry, and they've all got this little shake, and they've all got this, almost Parkinsonian kind of a thing going on. And for me, it's like all of those vets were equine vet at some point, and all of those vets used that particular dewormer. And so it's something my dad kind of, came up with, and we had talked about for quite a while. So,
yeah. I think it's also in the dental profession, like especially the older days when they were doing silver fillings and all the mercury and all that.
Oh, yep.
Yikes.
Well, isn't mercury the cause of actual Mad Hatter disease? They used mercury to do the hats and everything, and so it led to the actual Mad Hatter disease. So,
oh boy, I didn't even relate that. Oh no. Oh. Well, isn't it the most toxic thing on the planet or something?
Oh yeah, I think
so. Yeah, element at least. So yeah, bad news. So let's get into your passion in your practice. What are you most passionate about when it comes to practicing and educating your customers and helping your customers, your clients?
Well, education first. I love education. I love talking to everybody. I'll do career days forever. I love talking to the kids. And my favorite thing when I go talk to the kids is I bring a bag of cereal, like, the brown circle cereal, and I bring a bag of dog food and I pass them around the class, and I don't let them taste them or anything, but I say, can you guys figure out which one is which? And a lot of the time they don't know which one is a dog food and which one is a cereal. And then I also say, hey kids, so if your mom and dad let you eat this cereal all day long and not brush your teeth, then what are your teeth going to look like? And they're like, oh, that would be disgusting. Kids are great. And so then I segue into the fact that there's a myth that dog food helps with the teeth. The fact that the dog food and kibble that we've been feeding was actually started by in the 18th or the 19th century by a lightning rod salesman from Ohio. It's not a really good food, and it's so dehydrated that we're actually clinically dehydrating our pets. And I talk about eating the rainbow to all of my clients, and that we need to feed all the different colors of the rainbow throughout the week and get all those nutrients in. We need to use a variety of things. So I always used to laugh when clients would come into my conventional practice and say, eat raw. Or sometimes he gets table scraps. And I'm like, good for you. Thank you. Like, just make sure it's not pizza crust. Okay. Like, let's do some of the good stuff.
Right.
But they were always so pleased that I didn't chastise them. I get a lot of clients now because the way I work is I send them back to their conventional vet for blood testing and emergency situations and things, because I don't want to step on the conventional vet's toes. And so when they come back to me, they're like, I got chastised again for feeding raw. And I'm like, okay, well, we understand that that's going to happen. They don't know what they're talking about that much. That is what they've been taught.
Yeah.
So you were educated on it. So this is what we're going to do. So, yeah.
Yeah, no, it's so true. I mean, over and over and over again, we see this, people going back, secretly, having this affair with their holistic vet, and they're with the, it's like a marital affair, they're hiding it, it's like, and what's funny is some holistic vets, a lot of them I've had that, they don't do dentals, they don't do surgeries, they won't even do blood tests. Some of them do, obviously. But right. So you have to go to another vet to get those things done.
That's what I do. I mean, I send them back to their vet, but it's because I don't do emergency. So I'd rather them have that conventional side of things. So, yeah.
Yeah. And that's really interesting because, a lot of our customers, they'll email us and, they'll tell us about this contentious relationship they have with their vets. It's very, very, very upsetting. Here you are, you've got, you need a healthcare professional on your side, but this person doesn't support what you're doing and what's getting results. Like, the blood test could look great and they're still going to tell you. Right. Now, I was reading something recently about raw milk drinking in the human world. This little sidebar here. Drinking raw milk, for example. Do you know how many deaths have been caused by raw milk?
Probably not as many as, car accidents and heart, disease and stuff like that.
Yeah. Well, basically, since it became popular, 3 people have died from drinking raw milk. Yeah. And Louis Pasteur's awesome. He was smart, but it was also back in a day when things were harder to keep. We're so much more advanced with technology, and
we have refrigeration.
Yeah, I mean, our transportation's refrigerated. Everything's great. It's monitored all the time, and so now everybody's starting to get a hold of, for their dogs and themselves, raw milk, which I think is great. I think it's the pasteurized stuff that's not so good. But the other thing I heard in the same article was 100 people die from eating. Oh, shoot. I think it's mussels, not clams. I don't eat either one, so that's why I don't remember. But I think it's mussels. So, tainted, bacterial, I'm sure, contamination. Oh, we don't try to ban mussels.
No, yeah. Right.
It's very interesting. And they, state by state, they try to ban these healthy things. Oh, Lisa, what are we going to do?
Well, I mean, we got past it when homeopathy was kind of banned and outlawed, so I think we can figure it out. But yeah, I definitely send my clients a lot for raw goat's milk and different things for that nature, for the probiotic factor of it. So
yeah. Okay, so you also work a lot with horses. So what is it you spend most of your time on horses doing?
For horses, my exam usually consists of spinal manipulation. I don't say chiropractic. I mean, it's pretty much chiropractic. We just can't say it in Ohio because I'm not a chiropractor. But so spinal manipulation. I also do acupuncture and laser therapy. So that's mainly my routine. And then I do herbs as well. So Chinese herbs, Western herbs, and it just depends on the client that way. But most of the time, the big part of it is the acupuncture and the spinal manipulation.
Yeah, that's great. Okay, that's awesome. Do you ever use like the PEM? What is that? PEMF? I don't know why I'm blanking on it right now. The pads, like put them over them.
I've seen them used before. I don't have a pulsed electromagnetic frequency device right now. Yeah, I have a low-level laser that I use.
Wow.
So I use that. But a lot of my clients have beamer blankets or different things that they have access to. So I let them use those. That's not a problem.
Yeah. Well, that's where those came from, is the horse and I think a lot of good things come out of the money that's made, that's spent on, thoroughbreds and beautiful, prize horses. Yeah. So all that technology gets proven out and they go, hey, why don't we just make these smaller for dogs and cats?
Yeah. If I had enough money, I'd have all the
toys. If you had all the money, what are all the toys you'd have?
Oh man, I just went to a conference and I saw, I've always wanted like a thermo imager, just because you can see really good acupuncture points on thermo imaging. You can see changes in your acupuncture points. We used them when I was in my class for spinal manipulation. I would love a, what is it called? The new sound wave thing.
Like an ultrasound?
Yeah, but it's like for like pain relief and everything. I can't think of what the name of it is at the moment, but they do pulsed like that. I would love a higher class laser. Mine's a 2B right now, which it works great, but I'd love a class 4 laser, just different things like that. So
that's great. Because basically when you say class, it's power, right?
Yeah, this is power. Yep. I have a handheld ultrasound that my mom got me for my birthday one year because she was like, oh, you can do goat ultrasounds and stuff like that. So I have that. I do some puppy pregnancy ultrasound, stuff like that. So.
Oh.
Yeah.
So, all right. So that's very cool. The sound therapy, is it like sound therapy device or?
Yeah, it's pulsed shockwave. That's what I was thinking of. It's shockwave. So it just sends the sound into the tissues and creates healing that way. So increases blood circulation.
Yeah. What's so obvious, I hope that people hear this versus everybody who's had pets for a long time has been to a conventional doctor, and there's veterinarian, and there is usually just like 1 or 2 recommendations for the thing you've come in for. And tell me if I'm right about this, what if you feel this way. But when you go to a holistic vet, they go, well, there's really 1 or 2 things that I think are going to work, that are the low-lying fruit. But I've got like 4 or 5 things I can suggest for this that I can, they're arrows in my quiver. Is that quivers in my?
Right. Yeah. Arrows in my quiver, I think.
Yeah. So they have more options, more opportunities for healing. Do you feel like that's a true statement?
Oh yeah, I always tell people that I just have more tools in my toolbox than normal. When I was a conventional vet, you'd throw a steroid at it or an antibiotic at it and see if it sticks, and if it didn't, then you moved on to the next step. But in holistic medicine, I can do even for something as simple as vomiting, I can do homeopathy, Chinese herbs, Western herbs, acupuncture, even sometimes spinal manipulation on digestive issues helps as well. So there's so many different things that you can do, and they're always coming up with new things. So we do have people who do actual sound therapy with the different hertz and tuning forks, which is amazing. I'm not into that yet, but it's great. Massage therapy. There's so many different. Even I do aromatherapy, and some people just kind of think, well, oh, you're just making the animal smell nice. And I'm like, no, the chemicals in the actual compounds are living chemicals. And, I try to explain all that to them scientifically. And I know we get a lot of naysayers with holistic medicine, but it's been so scientifically proven. It's actually scientifically proven more than a lot of our drugs are that we're using.
Yeah. Well, a lot of our drugs come from botanicals. That's what aromatherapy.
Oh, yeah. Yep.
Yeah. They're just distillations or isolations of chemicals.
Right. You take away the actual part of the plant that is helping with your side effects because you've just knocked it down to one specific chemical.
Yeah. Yeah. I had my first black lab buddy when he was like 15 to 16. I was doing, is it called raindrop therapy from the essential oils?
Yeah.
And I don't remember all the particulars. I just remember first it's up and down his back, from his neck to the back, bottom of his butt. Well, not the bottom, the top of the back of his butt, just along his spine, using like it's a diluted oil, like, coconut oil or something. And then what is it, 12 oilers? I can't remember anymore.
I think it 10 or 12. I don't do rainbow as much as I used to, but I believe it's 10 or 12.
So you'd have to have these 10 or 12 bottles. You have to have them open. And then I would take the fur, so it like opened up a little bit, and I go drop, 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 drop. And you have to do that 12 times, and you do that once a day. It's like, and he's oily. He's a little oily. He smells incredible.
Right.
And it was explaining to me very, very scientifically why that works and why you do it in that order and all of that stuff. And obviously I believed in it, but I just remember going, oh my gosh, I'm this guy on the floor of my house pouring oils all over him, and he's soaking on his back. But I was doing a bunch of things, and I have told people many times, a lot of times if you're doing enough things, you don't need always to know what works. You want something to work.
Right. Yeah.
Depending on your...
I mean, I love aromatherapy. I start a lot of my sessions with it. So most of my animals are going to get some sort of an essential oil at the beginning of their visit, even if it's just a calming essential oil. But I mean, I use it on cats all the time. I know it's 6 one way, half a dozen the other with holistic vets and using them on cats. But if you're using something that's medical grade and not perfume grade, you're just fine. And it really was explained to me well, the different chemical compounds and how each of them work individually, and the fact that it's working on our primitive brain, which can work through the body for a lot of our different ailments.
Yeah, and they're so potent that you need to dilute them in like a base oil.
Mm-hmm.
And that also just rang true for me at the first time I've ever heard of aromatherapy. And I thought it was so silly, because all I thought of was candles and scents and stuff. But no, these are like real, I like calling them botanicals now because the natural chemicals in these are profound. So I have a genius holistic vet. I've had him it's been over 10 years now, and genius. And he does not like aromatherapy. He does not like scents around his animals. He thinks they're disruptive. What do you think about that?
I think it really depends on the animal themselves. And I think a lot of people that think that they're disruptive around the animals have a sensitivity to them themselves. So they may be more disruptive to them, which in turn will be disruptive to the animal's energy as well, because you're affecting the animal's energy too. So for me, I enjoy them. I actually have treated my high blood pressure from the vet field with essential oils themselves. And so if they're really strong, I use very, very slight amounts. I use pretty much the same ones with every animal. And I know sometimes if I have an animal that I think is going to be sensitive, I'll just open the bottle a little bit. And if they tend to shy away, then I'm like, okay, maybe that one's a little bit too strong. We shut the bottle and go away. But I have horses that want to eat the bottle. So, they love their essential oils. And I have owners whose cats will come and beg them if they haven't gotten their essential oils for the day. So for me,
Wow.
It's a lot more medical than, and for some people, I mean, some cats, that might be the only medicine that they can get on that cat or in that cat. They can't pill it. The cat will eat around it in the food, but if they can pet the cat and put the essential oils on, then we may be treating different things. So,
yeah. And then you said you use a couple. What are your go-tos?
well, I use a lot of different blends from a vet-run company that I use. But for me, for my blood pressure, I actually use ylang ylang.
Mm-hmm.
My dog's whining in the background, sorry. I use ylang ylang, clary sage, and bergamot for my high blood pressure, which has actually been clinically proven in kindergarten teachers in China to lower their blood sugar or blood pressure. So that was pretty cool. Hold on a minute. Nico. But German wired hair pointers, they always want to be in attention. But the ones that I use a lot, lavender. I use a lot of different types of chamomiles for calming. I use, vetiver is one of them that I use for liver disorders and different things.
Mm.
So there's a lot that I use that way, but a lot of blends that I use. So
that's great. I had a while ago another vet that you were reminding me. She would just put like a drop or two in her hands and rub it together and put it in front of my dogs, and my dogs love going there.
Yep, that's what I do. So that's what I
that?
do for all my horses too. I always put a few drops on my hands and just hold them out for the horses, and sometimes they'll try to like eat my hand. So
that's amazing. That's amazing. Is your camera like zooming in on you?
Yeah, it keeps moving.
Oh wow, what a trip!
I don't know.
That's amazing. No, it looks kind of cool. So what would you say about people who try to do essential oils on their own? There's a bunch of companies out there. Give us some do's and don'ts, warnings. Just be careful of cautionary tales.
And I always kind of do this when that meme comes around every year that essential oils kill pets. I always comment on it. And first of all, as long as you have a medical grade aromatherapy. So the couple of big companies that are out, you should be fine with. I use them, but you really want to watch out. You shouldn't buy them from like a big store, and the perfume grade are not actually living chemicals. So the spin on the actual chemical is completely wrong, and those can cause toxicities. With birds and cats and small animals, if you diffuse them in the room, that animal needs to be able to get out of there if they want to. So water-based diffusion is completely fine. I use it on horses, dogs, cats, whatever, as long as they can exit that area and be free from it. So cats, some of your hotter essential oils, your oregano, eucalyptus, peppermint, they might be a little bit too strong for cats, and they do have some chemical compounds in them that can be detrimental when used in high amounts for cats. So those are things that we want to watch for. But mainly, if the animal can get out of the way and get out of that room that you're diffusing in, they should be perfectly fine. We also have to remember that they are getting, same with smoke, they're getting this on their fur. So they have a higher likelihood of licking it off. So if you live in a house with a smoker or someone who's using chemicals, these essential oils can actually push those chemicals into the skin. So that's something we need to watch for as well.
Mm-hmm.
But yeah, mainly as long as you're using medical grade ones, personally, I would talk to your holistic vet about it first before you just go using a lot of them.
Yeah.
There are a few books out there, so if you highly educate yourself on it, you should be okay.
Yeah.
But you just have to go use caution and use them diluted.
Yeah. I'd imagine there's some great, I haven't looked, but great, free ebooks, paid ebooks, books in general that you can quickly, get it, become aware. But I think it's like everything. It's like preferences and also sensitivities from food to chemicals. You want to present it, like you said, to the animal. And, it's almost like you do kinesiology on them to see, what I don't know, I guess I'll use the word resonates for them.
Right. Oh yeah, we can do muscle testing with, with your essential oils as well. I've known a few people that use a pendulum for different testing that way. I like my pendulum, but I don't use it for clients because I'm not sure how well I use it. So that's just for me mainly. But I know a lot of clients that do that and muscle testing with the different essential oils.
Yeah, it makes sense. I'm listening to a book right now called Force or something. It's an audiobook. It's brand new. And it talks about the evidence of kinesiology. And there's a ton of serious evidence on kinesiology.
Right. Yeah.
Really amazing. Oh, power versus force. And it's kind of more like a business book, but it starts out with the case on kinesiology. So back to the essential oils real quick. One more thing. I just remembering my yellow lab Owen that I had. He's very silly and very daft, and he put his nose through a fence, and this dog bit him and put a real big. I know, this poor guy, and he's never, I'd always say, he was the kindest soul. I mean, he really was, and he never did nothing to anyone. He gets bit, so he had a hole, kind of like a pretty deep one on the top of his nose, and my holistic vet at the time recommended I use frankincense, and I would switch from frankincense to one other thing that's escaping me, one other oil. Got rid of that scar.
Yeah.
Amazing.
Copaiba or I don't know if I'm saying it right. Everyone says it differently, but Copaiba, it's an amazing anti-inflammatory. So I use that as well for anti-inflammatory purposes. So, Yep. Frankincense I'll use. There has been some studies with injecting aromatherapy. I don't suggest doing that. I don't do it, but some vets do.
Yeah, I did that early on with one of my dogs. I only did a couple times in the joints to cause the inflammation. Is that what you're referring? Yeah. But then later I went and it actually was fine. I mean, I thought it worked. It worked for him. But then I started getting into acupuncture and electroacupuncture, and that's a brilliant move.
Yeah, I love I do electroacupuncture, dry needling technique, aquapuncture, all of that. So
yeah. Yep. I had a vet who did the fire. She liked what is that?
Moxa? Yeah.
What's it called?
Moxa.
Yeah. She would do that. And I really thought, okay, I have gone over to the deep end now. And she explained it. And then I got into electro and I thought, okay, wait, this is kind of the same thing in a way.
When I was doing the conventional vet world, I kind of was dabbling in my acupuncture at that point. And I remember I had a client with a black lab, older black lab, that we were working on with immune-mediated hemolytic anemia.
Oh.
Had already gone through a couple of blood transfusions. Oh. We were doing acupuncture on him, making him feel better. So I was using moxibustion or moxa. And unfortunately, the smoke-less moxibustion does not work as well as the smoke moxibustion. And the smoke moxibustion kind of smells like marijuana. And so we were in our little clinic room, and we were doing moxibustion and acupuncture. And I've known this owner for a very, very long time. And he actually takes my son out hunting occasionally. And we walked out of the room just laughing at a joke, and smoke is rolling out of the room because we're doing moxibustion. And everyone's like, oh my gosh, Dr. Fox is high. I'm like, no. It was just the herb, and not that herb either. So yeah.
That's great. That's great. So okay, so now we've talked about that. Now, what about nutrition? What's your prescription in general for really, really good nutrition? Because we talked about the bad stuff. We talked about the kibble and the cereal with the kids.
Yeah. I try to get everyone on either a whole food diet or a raw food diet. most of my clients are on a whole food diet, at least homemade, balanced whole food with a recipe. They use a variety, so they'll switch out their vegetables weekly or monthly. They'll switch out their proteins, weekly, so that they get a variety of nutrients. But It is a balanced recipe that I use. And then if they're not doing that, I suggest that they get on something that's over-the-counter homemade style. So we're at least getting away from the dehydrated kibble, the canned food, the processed food, and we're getting more into the home-cooked styles. So I'll use those. My dogs are actually on an over-the-counter home-cooked right now because I just don't have time. So I understand when clients don't have the time to do it. I do try to cook them meals throughout the month, and so they do get home-cooked meals as well. With the raw food, some of my clients come to me on a raw food already, and so they're already using a regimented, balanced raw food with supplements, and so I'm completely fine with that. Obviously, if someone comes to me and they're like, oh, well, we're just feeding raw chicken breast, I'm like, okay, we need to add these supplements because we're not getting the calcium that we need. We're not getting the veggies that we need. I always explain to owners that if their animal is out in the wild, they'd probably be eating small rodents. Small rodents are eating grains. Our animals are therefore eating grains or eating at least partially digested grains in their intestinal tract. So we need some of that. We need some vegetables, the occasional fruit treat, that kind of a thing. Obviously, not too much sugar. And then we're looking at more of a high protein, low carbohydrate type meal for most of our animals. And so I get a lot of clients that come to me, with their animal in kidney failure or liver failure or something. And they're like, well, my vet prescribed a low protein diet. And I'm like, well, that's what they were taught in vet school, but it's actually not really appropriate because we need to actually have those proteins in order to build body structure. And so that's why we get a lot of cachexic emaciated animals with kidney failure and liver failure, is because their body doesn't have the protein to process it. And I get the point that the kidneys may not be able to pass out the protein or the protein may be damaging, but we really need to look at that a little differently and look at it as a chemical standpoint rather than a protein standpoint. And I think a lot of vets are getting more into that. I think it's kind of spreading. I don't see it as much with clients coming to me with that. But that's my big thing. It's just more whole food, more fresh food, more, even if they want to do raw. I really watch the raw just because I would rather them do an over-the-counter raw that's already clinically balanced, just because I worry about some of the younger patients. If their animal's older, I'm really not too worried about it at all, just because they're going to be getting the nutrients they need over the week if we use a variety of things. So,
Why don't you think that the younger clients will get the nutrients?
Well, the younger patient, anyway, not the younger clients, but
patient.
I just worry about the calcium phosphorus ratio in a lot of those diets, especially with the growing animals. Or animals that are, kind of middle-aged. They're still growing in places, still formulating things. When we get the patients that have cancer or, they're older in age, and we just need to feed them nutrients and get them in them versus it being complete. I don't worry about it as much being completely balanced with the calcium phosphorus ratio. But the younger patients, obviously, we still have growing, we still have bone remodeling. So we want that calcium phosphorus ratio to be appropriate. So.
Yeah. Okay. Yeah, it's very interesting. So, we need to get you a couple bags of the fermented superfoods we make, and have you give us some feedback. Well, we love that.
Oh
yeah. And we're working on a horse product with another company.
Good.
To get you involved in that too.
Yeah.
Well, this has just been a wonderful conversation, and I really appreciate your time today. So let's give it. I know you're booking out well in advance, but let's give your website just in case. And you're in what area?
I'm in Wellington, Ohio, but I actually have my Ohio license and my Michigan license. So I do see patients in Michigan and Ohio, all over.
Great. So your website's Divergent, DVM for Doctor of Veterinary Medicine.com.
Correct.
divergentdvm.com. And where else can we find you?
I'm on Facebook at divergentdvm or divergentdvm. I'm on Instagram at divergentdvm, and I'm my email is divergentdvm@aol.com. So pretty much if you type in divergentdvm, you're going to get me.
Brilliant. Okay, good. That's the way it should be.
Yep.
Consistent. All right. Well, Dr. Fox, what a pleasure. And I look forward to talking to you more.
You as well. Thank you very much.
Thank you. Bye, everybody.
Bye.